How's it going, guys? Nurse V here. So today I want to share one of my favorite cardiac topic, and that is Takotsubo, right? Otherwise known as the heartbroken syndrome. Wearing my heartbroken shirt right here, inspired by Elliott Smith, one of my favorite musicians. All right, so Takotsubo. So Takotsubo is a condition where the heart is weakened over time due to severe emotional or physical stress, taking on this appearance of like this octopus swimming or gliding through the ocean, or even more so an octopus trap device in Japan, hence the name Takotsubo. And what's interesting about this is that it's a non-ischemic cardiomyopathy, right? And it takes on many different types of names. It takes on transient apical ballooning, stress-induced cardiomyopathy, which is more of the politically correct term, broken heart syndrome, or even for the more German affluent, and I'm going to butcher this name, gebrochenes Hus. I think I did okay. But for the purpose of this video, I'm just going to call it Takotsubo, right? The historical background, where it came from, or it's quite unclear, right, as to where precisely the incident of Takotsubo was first seen. But what we do know was in 1986, 44-year-old woman came into the ER when she was having substernal chest pain after learning that her 17-year-old son had died to suicide. And then hours later, her pain became even more worse. It started to radiate to her left arm. She was on nitroglycerin, which had very minimal relief. Her care team was able to dig up and found some old routine EKG that she had a few months ago, and it showed some pathological Q waves, possibly indicating that she had a myocardial infarction back then, long before. However, it wasn't until 1991, just a few years later, where Takotsubo was first coined and well studied by Dr. Hikaru Sato, who's a Japanese cardiologist over at Hiroshima City Hospital, and he was one of the pioneers for reperfusion therapy. And one day when he was performing an angiogram on a patient, what he noticed to his surprise was that this patient's heart showed some left ventricular apical ballooning with some wall motion abnormality. But the interesting part was that she wasn't having any type of stenosis in the coronary arteries. There was really no signs of blockage. So he was impressed by the heart appearance, and so he termed the heart Takotsubo. So the pathophysiology of Takotsubo still remains elusive. It's still quite uncertain, but there are several hypotheses that may suggest that because it's coming from stress, right, some emotional or physical stress, there may be some biochemical properties such as elevated levels of plasma, fluctuations of catecholamines, some microvascular disorder, inflammation, epicardial coronary vasospasms, or even aborted myocardial infarction that may be attributed to the development of Takotsubo. What's also more important to note more recently was that estrogen deficit was found to be one of the leading causes for Takotsubo too, which will then lead me to my next topic, the risk and demographics. So Takotsubo is found common in postmenopausal women, okay? So it's found more in women than it is in men, and about more than 90% of Takotsubo cases have been found between women from the age of 50s to 80s, right? But it's even more prevalent in white women, and even more so in Japanese women too as well. The symptoms that you would expect, the clinical manifestation of somebody who is diagnosed with Takotsubo, is very quite similar to somebody who's coming in for chest pain, right? You're going to have your traditional chest pain, shortness of breath, dizziness, syncope, cold sweats, things of sort that would allude to having maybe an MI or severe congestive heart failure. Some of the diagnostic tools that providers may want to consider when they're suspecting of somebody with this is, getting a baseline EKG, getting some blood work done. Let's go ahead and get a complete echocardiogram, or even more of a gold standard, an angiogram, right? With an EKG, you would expect to see initial presentation of ST segment elevation in both the anterior and the inferior leads, or perhaps a more diffuse global ST segment elevation. And sometimes a few days later, if that same patient gets an EKG, you'll likely see that ST segment elevation start to resolve, but then you'll get more of a diffuse T wave inversion and poor R wave progression. So the EKG can change over time. In terms of blood work, right, you want to be considered checking their troponins, you want to check for their BNP. For echocardiogram, we're expected to see some type of wall motion abnormality in the left ventricle, perhaps a hypokinesis or akinesis, reduced ejection fractions and cardiac output, which may suggest a heart failure at point. And then angiogram being the more invasive route. And as mentioned earlier with Takotsubo being a non-ischemic cardiomyopathy, typically angiogram can show a clean artery, right? So you're not going to find any occlusions. So treatments. So in terms of treatment, there isn't really a one direct clean form of treatment for patients with Takotsubo. It kind of really depends on the severity of the symptoms at present. But for instance, if patients are exhibiting heart failures with fluid backup, you may want to consider, giving them some long-term treatments of diuretic, either an ACE inhibitor as well, or maybe an angiotensin receptor blocker medication to kind of reduce some of that preload and offload on that heart. Emergent treatment as well, such as nitroglycerin, maybe some inotropes or antiarrhythmic medications may be considered as a form of supportive medication. But, again, with all these medications listed, it's also important to note that outpatient program or cardiac rehab may be a considered guideline for patients to kind of help manage their emotional and physical stress too as well, and kind of help figure out some of their lifestyle changes to really sustain the heart and to be more of a better state. Typically, the prognosis for Takotsubo is quite excellent. I mean, typically about 95% of the patients who have undergone Takotsubo will complete recovery in about 4 to 8 weeks. But however, reoccurrence rate is common, and it can occur within the next 4 years of 30% of patients after their first event as well. So there you have it. That is Takotsubo in a nutshell. It's such a very still unknown mystery cardiac disease to me, just because it doesn't show all your clear clinical manifestation to pinpoint. And like the differential diagnosis for Takotsubo can be kind of tricky. When you see it, you get kind of excited. So Takotsubo, heartbroken syndrome, takes on many forms of name. There you have it. Hopefully you enjoy this video.